So let me turn to Dr. Rania. Now, Dr. Rania has a lot of experience in dealing with the psychology of Muslims in particular. You also have an academic interest in these areas. So now, this is quite heavy stuff, you know. It must seriously impact families, you know, considering the way we live, our culture, you know, isolating our elders, you know, putting them separately. Our kids are with us, all the schools are closed. Now we need to deal with our kids. At the same time, we have the pressures of dealing with other people in our homes, and it's impacting us financially because some of us are out of work, and we're not sure how long this will go on for. So, Dr. Rania, from a psychological perspective, also clearly understanding that we have a quite a different approach to psychology in our Islamic tradition. What particular, what's the current situation going to be that's going to impact Muslim families and homes with this infliction?
Yes. Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. First, thank you for having me on, inshallah, for this conversation. And certainly, as you mentioned, it is quite a difficult question. I think the first place we really need to start the discussion is really to understand what kind of emotions are showing up in our families and households. Probably two emotions more than anything else at the current moment. The first is anxiety, and the second is fear of the unknown mostly. And I think I'd like to start by really saying how important it is to emphasize that these are normal reactions at this time. There's a lot of concern about why, as Muslims, we're having these emotions, but it's actually, we learned that a small amount, a certain amount of anxiety is actually healthy. It allows us to kind of get able to take things when needed, like, as you mentioned, planning our families and work around our families, planning meals and essentials, activities with kids, figuring out how to work from home, alternating work, things of that nature. It's really when those emotions go overboard that become problematic. But it is normal to feel this way. And it's important to remember that Allah subhanahu wa ta'ala created these emotions just like he created any other emotion of happiness and joy or sadness and depression and whatnot. It's what's important here is what we do about them, inshallah. And I really want to, just mention too that unless families had a lifestyle in which the children were already homeschooled and parents were already working from home, this is a very strange and unique situation for many households, as you mentioned, with our elders. And we're worried because many of us take care of multiple generations from children to elders, and we're trying to balance all in between. So I think that's the first place to really understand that this is a new territory. And some of these emotions are quite normal.
So just more specifically, the kind of advice that you would probably give. So, I mean, clearly, you're going to get quite inundated by a number of people.
Sure. Yes.
What kind of things are you going to expect? What's the kind of response you're going to get from these Muslim families? Is it going to be mainly, I mean, are you already getting those kind of responses? Are you getting trauma? I mean, I'm hearing certain individuals, even as a general practitioner, we're getting recurrent calls by my patients who are telling me I can't go to sleep, I'm panicking, I'm concerned for my family. And it's not just the patients, even my own staff are concerned. So, and it's very unclear in terms of who's got it, who hasn't got it. There's no testing going on. So it really puts a serious state of panic. What particular advice would you give those kind of individuals who are really panicked by this, really anxious about the circumstance?
Absolutely. I think this is where, if I can put them into 5 steps that are hopefully practical in order to cope with anxiety that's coming up. And as you mentioned, it is across the board. And I think there are some people certainly at the front lines, our healthcare workers, for example, or those who are more susceptible, like our elderly. However, it's really, as you mentioned, affecting everybody. So the 5 steps that could hopefully, inshallah, be practical. Number 1 in this is to talk. And this is, of course, our field. We do a lot of talking and listening. And I think this is really important globally. The reason for that is the bottling up that I'm finding people doing, especially those who others are depending on. So the ones who are the caretakers of the families, they're kind of bottling up a lot of these emotions. But unfortunately, the situation is very overwhelming. And eventually, people will be overwhelmed too much. But if you were to talk to people that you are that you trust and who are able to listen, and then also lend a listening ear to those who are most concerned. For example, our elderly, they may be, for example, isolated, but to be able to phone them or to do a video FaceTime kind of call with them really helps alleviate them to listen to actually what it is that's concerning them the most. Or those who are feeling that they do want to go out to the masjid, to explain and to hear why it is. A lot of times the underlying reason is actually a lot of isolation and loneliness. But if that was alleviated in other ways, then they wouldn't be putting themselves at risk in such situations as well. So listening, and also understanding that it's important to be flexible, that people are, that they show their emotion, like you mentioned, trauma or anxiety, in different ways. Not everybody shows them in the same way. So we should not judge or assume, and we should be or shame also is another concept that we're seeing a lot of at this moment. To be very supportive of each other is most important. Number 2 on this list of, inshallah, practical coping mechanisms is to really moderate the amount of news. Certainly we want to hear day by day what's happening, but I'm finding that people are very much too plugged in. They really are. They're being overwhelmed by the amount of news, and because we're a very connected society the way we are today, we're being inundated with information much faster and quicker than any other time in the past. And so this is really the time to turn inward as much as possible, because we are, at least here in the US, we're very much quarantined. Here in California, we're in a shelter and home situation. And this means that we are home with our families. And this could really be an opportune time to really turn it the other way, to spend the quality time with family members that we don't necessarily have the chance to do. And for people who have children at home, I think there's a lot of anxiety about how are we going to school them when schools are shut down. And really a reminder here that learning doesn't happen just in books and classrooms, but the best learning actually happens between the lines, as in to say, this is really a wonderful time to really talk about everything that the esteemed scholars before me had spoken about, really the concept of why Allah subhanahu wa ta'ala brought this to us and how he has the ability to bring us through this. And thinking about lessons from, whether you come at it from lessons of the seerah of the Prophet ﷺ and how his own parents were affected by the fever of Medina and both died because of it, leaving him twice orphaned, or whether you're thinking about it from a fiqhi perspective of why, it is that we're, in the adhan, you tell people to pray in their homes. Many people were seeing this and were very surprised by it, but it's rules that are in the fiqh books. In the,
Dr. Rania, I don't want to push you, but if you can come to these 5 points, because I think they're very important. That you,
yes, exactly.
Key points are always an essential way of approaching some of these
Absolutely.
issues. You just can tell us briefly what those full 5 points are, and then we will have plenty of opportunity to go into the details.
Sure. Spending the quality time with family instead of really being plugged in, I think, is a really key point here. Number 3 on this list is really taking time to take care of oneself. And I think that's a very important point of taking breaks, eating healthy, sleeping well, and engaging in spiritual practices, which inshallah we hope to get into in more detail.
Sometimes you can be so bogged down with everybody else in your family, you forget yourself. Yeah.
And taking that time, yes, absolutely, to really steal that time away, and to really, in other, non-Muslim practices, they talk quite a bit about meditation and whatnot, but we have our own forms of these things. And the tafakkur and tadabbur of really taking the time away and contemplating, this really helps bring anxiety down and bring the emotion of fear down as well. When you hold on to concepts like, la yukallifullahu nafsan illa wus'aha, that Allah is not going to burden a soul more than it can bear, and such spiritual aphorisms like this. Number 4 is to take action. Dr. Munir earlier was talking about how he went to his community members, and this also brings anxiety down quite a bit for people when they turn that anxiety into actionable steps. So figuring out who needs help in the community, who are the elderly that need phone calls or need grocery shopping, really helping, and having children also be part of this plan is really important. It brings their anxiety down too. An important thing we know in our field is that children pick up on our emotions. So anxious adults also make for anxious children. So if you're able to bring them into the action plans, it also helps them feel a sense of control and brings their anxiety down. And number 5 on this list is really getting help when help is needed, because not everybody's going to be able to handle the anxiety just from the first 4 things I mentioned. This is where the professional healthcare providers, mental health providers are really here to help. I know here at the Khalil Center, which is a Muslim counseling center, we have all of our sessions now converted into web therapy. And I know that our counterparts in the UK are doing the same. So I really encourage people to get that professional mental health help if they feel the anxiety is much too high that they are able to bear.
So in essence, there's a fear that sometimes you can internalize this so much that it can have a massive impact on you, especially when others are dependent on you, and then that will have a huge impact on the rest of your family. So these are 5 points that are very important for us to all take on board to ensure that we're protecting ourselves, not just physically, because physically is paramount, but also spiritually and psychologically. And that is something that we need to also take into consideration in circumstances like this.